Welcome to Axrem Insights, developing healthcare through MedTech and innovation. Join Melanie Johnson and Sully Edgington as they talk with our industry leaders and experts.
Hello, I'm Melanie Johnson and I'm here with Sally Edgington. Welcome to episode 3 of our partnership podcasts. Today we have the pleasure to be speaking to some of the trade associations that we work closely with. Welcome David Stockdale, CEO at the BHTA, Helen Dent, CEO at BIVDA, and Nikki, the BAREMA chair. Now, thank you all for being on the show and allowing us to get to know you all a little better. With our podcast theme being partnerships, I will hand over to you all to tell us a little bit about yourself and your story. Now, let's start with Nikki.
Hi, so I started off in a clinical environment as an operating department assistant, which are now operating ODPs. I very quickly found a passion for training, so I took on a teaching diploma in anaesthetics and surgery, then left the NHS and started to work in the life science sector for an anaesthetic and orthopaedic company where I was privileged to launch an innovative airway device which revolutionised anaesthesia, which was the laryngeal mask airway. And from there, I decided to embark on a sales training and embarked in a marketing degree. In 2012, I was appointed to do Intervent Direct, which was the laryngeal mask company. And then after that, we sold that company to in 2013. And then I was asked to form a research company in intensive care, which is what I'm doing today. But in 2014, I was also elected as BAREMA chair, which is all very challenging.
Keeping busy.
And do you want to just tell us a little bit about BAREMA, Nikki?
Yeah, BAREMA. So BAREMA was formed in 1971. It looks after the anaesthetic and respiratory and critical care manufacturers. So we're very much set up to do guidelines, cross standards and regulations for our industry.
Thank you.
Thank you. And now over to David.
Yeah. Hi, everyone. So David Stockdale. My background really is in not-for-profits, so graduated from uni with a business studies degree and went straight into the voluntary sector, working across a number of different projects, but working really closely with government on youth policy and looking at how to make lives better for children and young people. And then really stayed in the charity sector. And prior to being at BHTA, I was at the British Tinnitus Association, which was really the first time I worked closely with the NHS and the medical and clinical professions more closely. And I absolutely loved it. I loved the passion that there was. I loved the values in terms of really wanting to help and support people and just make the world a better place as well. So really enjoyed that and really enjoyed getting involved in the research too, and just felt it was a really good opportunity to come along to the BHTA then and learn more about the business side of it, if you like, as well, and how businesses interact with the NHS and the broader health system, and just look at how we can really help build those opportunities as well to maximise the NHS for everyone.
And do you want to just give us a quick overview of who the BHTA are, David?
Yep, sure. So the British Healthcare Trades Association was set up in 1917, became the BHTA as we know it now in the 90s, and is really there to represent health tech, if you like, across the UK. So we have a number of different sections, including prosthetics and orthotics, disabled children's equipment, independent living and mobility, stair lifts and through floor lifts as well. So a real breadth, if you like, of different areas of healthcare and health tech, working with the NHS really closely, but also then working with local authorities as well to make sure, for instance, the best medical equipment can get to the children who really need it as well. So a real breadth, and that gives you a really great opportunity, if you like, to understand those areas and those different bits and work a little bit like Nikki was saying as well on standards and really ensuring that those industries are playing to the max that they can.
Great, thanks, David.
And finally, over to Helen.
Hi, yes. So I really love working in diagnostics. I've worked in diagnostics for my whole career. I started off as a customer in NHS Purchasing and Supply Agency in pharmaceuticals. And over my career, for about 10 or 11 years, I was a procurement manager in the NHS buying diagnostics. I worked at NHS Blood and Transplant. And from there, I moved into commercial. So in commercial, I worked across Europe and in Russia, working on contract pricing, working on the delivery of diagnostics and IVDs into customers across the EU primarily. After that, I joined BIVDA and as Chief Operating Officer, and I've been at BIVDA maybe 4 years now. So my professional qualifications are procurement. I've got a master's degree in strategic procurement. I've got a master's degree in public procurement law and policy, and I'm a member of the Chartered Institute of Purchasing and Supply. This lets me work within the market access areas and with a really deep understanding of the actual sector as a customer, as a supplier, and then as leading the trade association.
And Helen, do you want to just give us a quick overview of BIVDA, please?
So, yeah, of course, BIVDA is the British In Vitro Diagnostics Association. We've been around since the early 1990s. We represent manufacturers and distributors of in vitro diagnostics, which effectively are blood tests, tests on saliva, PCR, near-patient testing, and the general blood tests that are done in hospitals when people are diagnosed with long-term conditions and also acute care.
Great, thanks, Helen. And we all know each other quite well because we work quite closely together as trade associations. And I know that you're all really passionate about what you do. So I just wondered if you could tell me a little bit more about where that passion comes from and what are your drivers. So if it's okay, I'll go over to Nikki first.
Okay, thank you. So I think for me, I'm very, very self-motivated and always want to achieve objectives and overcome lots of challenging goals. As you can imagine, working for, obviously being part of an association and a company, there's lots and lots of challenges. But I think really for me, it's more about committed to making a difference and enforcing change in sort of patient care and safety. And I think the industry does have had the ear of our specialists, and certainly for us at BAREMA, it's very, very good to be able to liaise with certain groups who actually obviously share the same goals, which I know all of us on this call do. But I just think it's down to sort of strong personal ethics and sort of standards, and just also following through, believing in something and trying to achieve that goal collectively.
Thanks, Nikki. And David, yourself?
Yeah, I'm thinking terms of what keeps me ticking and gets me out of bed in the morning, it is that opportunity that there is to really make a difference, especially when you look at clinical practice, and also how members of the BHTA can really help sort of deliver some of those government aims as well. So a big driver for us at the moment is keeping people in their own homes for longer, and there's so many opportunities there to just do better and really add value to what's already in place and what already happens, but also look for those opportunities and those, look at how to answer some of those unanswered questions, if you like, in terms of how do we do that? What does it need to look like? What, is the optimal way to do that and how to achieve it as well? So, really interested in all that and looking at sort of, pathway design and how health and social care can interact to help everyone to do things like stay in their own homes as well. And on top of that, I really enjoy engaging with the research as well. So both the sort of clinical, but also the medical research that happens in the area. I think it's really fascinating. It's great to interact with some of those government organisations like the National Institute for Clinical Excellence and look at how some of that research is interrogated and utilised, and just understand where those opportunities are as well to improve that knowledge base to ultimately, again, and ensure that we are getting the right product to people at the right time, at the right value as well, and just how can we do that better and more effectively.
Thanks, David. And Helen?
So I couldn't agree more with Nikki and David on what they've said about the opportunities for collaboration. And for me, primarily, is the ability to make a difference and also being able to see how that difference is implemented and the impact that has on patients. As a leader of a trade association, we're involved with the policy and the delivery. And then we can also see what that's like when we're actually in the public or we're a patient ourselves. So it's really rewarding to see work that we have done actually be delivered in the healthcare system. Working with other trade associations and understanding our part of a wider sector and how everybody can contribute and everybody can make a difference is really important. And that's certainly what I see through working with our members. So we have 250 members, and the the genuine excitement and the genuine innovation that comes through our membership is just exciting on a daily basis. And that's what really, really makes me tick.
I couldn't agree more, Helen. I was just going to say, as the CEO of Axrem, I just feel really passionate about what we do, because I do feel it genuinely makes a difference indirectly, if you like, to patients. And I think that you can see, I've worked in very highly competitive sort of sales environments in different organisations and sectors. And people that work in our sector, in the health tech sector, actually there is that passion and that care for the patient, and that's lovely to see. And I was quite taken aback when I first, previously obviously worked for the BHTA, and I remember starting working with their members and was really kind of taken back by just how passionate they are. And like you say, at the end of the day, we're all going to be patients, our families are going to be patients, and we want the very best for everybody. So yeah, totally agree. My next question, and we know, because we all lead our organisations, the benefits of being part of a trade association and an industry voice. So it'd be really good just to have a bit of a discussion around that and what you see are the benefits of that. So if David, you want to get us started on that, that would be great.
Yeah, thanks. I think part of it is that power in numbers, isn't it? It's, the greater the collective voice, the more weight that voice has and the more opportunity you have to influence. And I think that's a really critical role that trade associations play in the policy landscape we're in now, where there's lots of challenges, if you like, in terms of government priorities, lots of issues in terms of Brexit and COVID recovery. So, how do we really support that policy landscape, if you like, as a collective, and make sure that industry voice is heard? That only really happens, I think, if you do have that presence and those real numbers, and only if people are then contributing to a trade association as well. I always say to our members, it's your trade association. The BHTA is here for you. It's here to serve you. So what do you want us to do? What should be our stance on different things, and really make it that go-to place for everyone to interact, but also hopefully that members see that value, if you like, in terms of being able to have those conversations on their behalf, but also then just look at how you upskill industry as a whole, I think, as well. How you produce guidance and information that supports a marketplace, but also just supports in industry to communicate in terms of the value they have, and how, the value to consumers as well, in terms of how to look at purchasing some of this equipment that, no one has probably looked at prior to actually needing it. So how do you really start to help educate and develop a consumer base, if you like, for some of those products as well, and do it as part of a trade association? And really critically, I'd hope that people get a lot out of the networking opportunities as well, and the opportunity just to come together as an industry, have pride in the industry, and start to just collaborate and discuss different ideas across, but also just that opportunity to have a bit of a feeling of, shared progress as well.
Thanks, David. And Helen, what would you like to add?
Absolutely. Everything that David said there. I think it's important to understand that members, the more members can put in, the more that they will get out of a trade association, because exactly as David said, it is a member-led organisation. We don't want it to be the world according to Helen. We want to take that information and then we want to use that to be a representative voice for our members, so members can have a say on how the industry is represented to policymakers. There's the network on opportunities where they can meet other industry professionals, lots of access to information. There's training, there's documentation, there's updates, there's newsletters. I think the key thing really is the support to address issues that members are facing on the ground whilst they're operating in our environment, and then us utilise our networks and our collaborative relationships to make that better for them, to make the UK a good place to work, a good place to do business, and to utilise our advantages to help them advance.
Great, thanks, Helen. And Nikki?
Yeah, I mean, it's great listening to David and Helen and obviously their organisations. But I think for our members and for me, it's being able to discuss sort of common issues and concerns with individuals and companies who all share the same sort of aims, objectives and direction. And I think if you went back sort of 10 years ago, I don't really think trade associations did sort of collaborate with each other. And I think it's really great that nowadays we do. And I have to say, it is down to the people that are leading the associations. I think they in themselves have actually changed that practice. And I think it's made it a much, much nicer place to discuss common issues. And although, because we've all got the same game, we all want patient safety, better for patients, better for us. So I think it's just brilliant that we can now all sort of share those common problems and resolve them. And what is great is when you do have a problem and you come together and then that is resolved. It's a really good feeling that you can then share that with everybody and be part of making good change.
Yeah, and I concur with all three of you have said. And I think one of the things that I like about a trade association is we empower SMEs. So an SME is sitting around the table with a large OEM with an equal voice. And I think that that's really important, that we create that safe place for those conversations and those interactions to happen. And I think as well, like obviously our members, we're a members-led organisation, so members set the agenda. So we talk about what they want to talk about, and we, the strategic direction of our organisations is set by our boards or exec committees, which are led by members. And so I think it's quite a unique place that we are. It's very difficult. Some people say to me, what do you do as a job? And even my family now don't understand, even though I try and explain it. But I think when you work in it, you just get it. And I remember when I started with the BHTA, I just remember sort of within a month, I just got it and I just knew what could add value to an organisation and how we could deliver more to members. And I've seen that in the 5 years I've worked for Axrem, that all of our organisations have grown and flourished and are continuing to do so. And that's really great to see. And I think that companies are seeing more value in trade associations. And a lot of that is down to the leadership within those organisations and the perception of the companies and the work that we're doing with government and other key stakeholders. So I feel like we should all give ourselves a little pat on the back at this point.
I'm jealous you understood what to do after a month. It took me a bit longer than that.
Yeah, I'm still learning. Well, super. Thanks, guys. I know we've obviously touched on this already about collaborations, but what value do you see in trade associations working together? So if I go to Helen first, please.
There's value at different levels. Ultimately, it can help with resources, and resources are tight, and we want to give the best value for money for our members. So where we can avoid duplication and where we can supplement that expertise through collaborating with other trade associations, it absolutely should be done without question. I think also as well, collaboration instead of competition is useful as well, because members can't be members of every trade association. And I think if we can collaborate to avoid that, I think it's very important to be able to do that as well. It's all about giving value to members. It's all about to get the best information for them. And it's all about putting the best resources in the right time and the right place in the right subject matter.
Absolutely. It's all for the greater good, really, isn't it?
Completely.
Yeah. And Nikki, over to you.
I think, even just on here today, each association has its own sort of specialities and goals, but with a common denominator of ensuring, as we've all said, patient safety and improving patient care. And I think that's, something that we all should be proud of. And we always, to the best of our ability, we do deliver high levels of quality, safety and reliability.
Absolutely. And David?
Yeah, I think throughout my career, I've been incredibly passionate about collaboration and looking for those opportunities to collaborate and partner. And I think, as both Helen and Nikki have said, there's so many opportunities to do so. Ultimately, as Helen said, it's that bottom line about how do you increase member value, and that's got to really run through everything I think that we do, as trade associations. But beyond that, we can learn from one another. We can, look and understand and share, I think, a lot more in terms of that pooling opportunity to create those opportunities, that additional member value. But also from a selfish point of view, I think there's something about just having that network of peers and other organizations that are, kind of in the similar area, but not quite overlapping, where you can just, learn from, reassure one another, support one another, challenge each other where that's appropriate as well. And just having that network can only be positive, I think, in terms of developing the member prospects, the member value, gathering that intelligence that's so critical to trade associations to be able to do what we do. Ultimately, I said all rolling into that member value piece, but there's just so many opportunities, I think, for that sort of growth of the trade association, but also just that personal growth and reassurance as well. That, you know, can be quite lonely occasionally in a trade association. So all that helps too.
Yeah, absolutely. And I know in terms of the work we do at Axrem, when I first joined Axrem, we were quite a closed book. And now we collaborate a lot. And it's great to work with other trade associations because we can learn from one another and share best practice. And, you know, there's crossovers between our organisations. So, for instance, with Axrem, there's a crossover with BHTA on DFibs. With BAREMA, there's a crossover on the patient monitoring. And with BIVDA, there's a crossover on digital pathology. So it's within our interest to want to work together. And, we're not the expertise in digital pathology or DFib. So actually making sure you've got the right stakeholders around the table is so important. And, I don't want Axrem to be a jack of all trades. I want us to be a master of diagnostic imaging and radiotherapy in the different areas that we cover. And so it's great to be able to tap into sort of the community that we've built with other trade associations to share that expertise and knowledge and seek the right information and views on things. So thank you very much for that collaboration. So looking ahead in horizon scanning, what do you think are the biggest challenges that you can see for industry in the future? I'll come over to Nikki first on this one.
I think for me, it will always be the lack of innovation that may come through. That's my background. I've only ever launched innovative products. And, when we look at all of the changes in regulation, looking at sustainability and net zero, I just worry that there's just so many companies, and we did have that sort of discussion in previous discussions where there's just so many companies that just they're just not going to do innovation. And it isn't the big companies that always bring out the innovation. It is the SMEs. And my worry is that with all these changes is that we're just going to lose innovation. And that is really my main concern.
Thanks, Nikki. And David?
Yeah, to build on what Nikki's saying, I mean, we've got a really challenging regulatory landscape at the moment that certainly in the short to mid-term doesn't look like it's going to be resolved. And in that environment, I think it is incredibly hard to bring a medical device to market, if you like, to understand what it is, to put the investment in that's needed and to really go push forward. It takes a brave entrepreneur or company to do that, sadly, I think, at the moment. So we do need to get that right. And I know it's something all our organisations are working on to support the MHRA and others to look at what that regulatory environment needs to be. But I think beyond that, there are things out there that I think all our companies will see as an opportunity, but also a challenge. So more general trends such as an ageing population, which probably means our products will be more and more in demand. But at the same time, is there going to be a health system that's going to be able to deliver that? And how do we work on some of the other really critical areas that, I think all of us as trade associations recognise, like workforce within the NHS, that's going to be absolutely essential to be able to do some of this. And I think our members, are mainly, delivering medical devices and health tech, but at the same time, there's such a concern, I think, in terms of what does that NHS look like? Because as we've already said, we want it to be there for our children and our grandchildren. So actually, how do we start to have some of those really thoughtful conversations about what does the future health tech landscape look like for the next 5 or 10 years becomes really, really critical. And I think my real hope to that challenge is that we've got a government that wants to listen and wants to hear and wants to have the conversation now about where do we go and what does a health care system look like within the parameters and restrictions that we will have around finance and budgets and everything else as well.
Yeah, thanks, David. And Helen?
I agree with Nikki and David. Again, the NHS is a high barrier to entry, low profit organisation. And whilst it continues to be so, that is always going to be difficult for our sector. However, it doesn't need to be that way. There are lots of opportunities where, with the NHS and the system working with industry, we can take out some of that unnecessary cost, because it doesn't have to necessarily be a high cost NHS. It can be a low cost, better profit, easier access market. And then the patient will continue to get the best equipment and the best technologies and the best diagnostics, because it won't be a barrier to deal with the UK. We need to make sure that the regulatory framework, we need to make sure that the procurement framework, and we need to make sure that the horizontal policies such as sustainability, equity, diversity and inclusion, environmental, all don't add unnecessary cost to an area that needs to be or wants to be world leading in science and healthcare.
Yeah, I couldn't agree more, Helen. And actually, when you were all talking, sort of my answer from an Axrem perspective on this question was challenges around aged equipment, around the workforce, which was mentioned. You know, we don't have enough radiographers and radiologists to, you know, the term there isn't enough pilots to fly the planes is most certainly a reality for our industry, and also the economic situation, you know, in terms of funding. And I think we're hearing the right messages from the new government at the moment around, we want to see long-term strategic funding. We don't just want, you know, short-term big amounts of funding to be pushed at something, and we want a government that's going to look at funding beyond their term or their potential term, so that, you know, we do start buying more smartly for the NHS. So fingers crossed, you know, the government continue with the messaging that we're hearing.
Thank you, guys. It looks like we're all kind of heading down the same path, which is great to hear. Now, kind of a bit of a change of tone. So now is for my quirky question. If you could have any superpower, what would it be and why? And I'll go to David first, please.
It's a boring one, but I think I'd have to go for flying, especially if you have to get the Midland Main Line at home tonight. You know, it's never fun. Definitely flying.
Cool, fair enough. And Helen?
That's the best question ever. I would totally have already decided this hundreds of years ago, that I would just be invisible.
And what are your plans?
Can you imagine if I was invisible? I could get on any train home and nobody would know, because I wouldn't have to pay for it. I could go to any meeting that I wanted to, because I could just walk through those doors and be that fly on the wall. I could go into cinemas. I could go into pubs. Oh, honestly, I would know everything. It would be amazing.
Sounds like you've thought about that one quite a bit. Considering we just dropped you in this one. No, brilliant. And Nikki?
Mine's more practical. Because there's so many demands on everybody. For me, I would just like to be able to be in more than one place at once. And I kind of achieved that a little bit during COVID, where I was actually in a very, very small meeting, but I was also on a Teams meeting at the same time. But I'd love to be able to do more and organise more things, but physically be there, and being there in more than one place at once would be fantastic.
Oh, that would be an amazing super. I think with all of us in the roles that we actually do on a daily basis, being in two places at once is definitely something I think that we would all concur to. So I'd just like to thank you all for being part of today's Axrem Insights podcast. So big thanks to David from BHTA, Helen from BIVDA and Nikki from BAREMA. And thank you to all our listeners.
If you've enjoyed today's podcast, don't forget to hit subscribe, or feel free to share the podcast with friends.